I will tell you, as doctors, we have learned more about teenagers and concussions in the last 2 or 3 years than we've learned in the last 20 or 30. Really, signs and symptoms are still the mainstay of our diagnosis and initial management.
We also want to be looking at other factors like cognitive recovery, things like memory, processing speed, attention, clinical efficiency or cognitive efficiency.
There are other non-cognitive assessments other than just symptoms alone that can really make a difference.
We also are starting to look more at the balance, the vestibular, the visual tracking.
And evaluating how young people are doing in school as well as out of school.
We can't assign a grade to the concussion at the time of the injury. We want to take more of a retrospective look at how long does it take for those athletes or those patients to feel normal again.
If computerized testing is used, especially in a group environment and doing a preseason baseline test, for instance,
they really need to make sure that they're trained in the utilization of these tests so that not only are the tests performed correctly, but they're also interpreted correctly.
It's often easier to do in a school setting where you utilize a computer lab and test multiple kids at the same time. However, it's also been shown that children perform differently in a group setting with a mass environment that they do in a quiet, individualized setting as well. And those can certainly affect your outcomes.
It can't be overstated that this cannot be an isolated test. It's got to be something that is used in conjunction with your clinical finding, with the comprehensive evaluation process, and it can't be something that's a standalone measure to determine when it's safe for someone to return to play.
CT scans and MRI scans are clinically useful from the perspective that they rule out bleeds and the need for urgent intervention, but they don't help us much with the diagnosis of concussion.
For non-research purposes right now, we still don't have a good scan for concussions. By definition, if someone has a concussion, their CT or MRI will be normal.
Concussions are a functional disturbance, they're not a structural injury.
Concussion occurs at the cellular level, and the balance of calcium and potassium in the cells gets very disrupted, and it occurs over the period of several hours to several days, but won't show up on any type of measure like a CT or an MRI scan.
CT scanning is best used if you're trying to rule out bleeding on or within the brain. MRIs are best used if you're trying to rule out a structural defect.
So the assessment process really is the ability to take everything that we know about the injury, take everything that we find in the history, put it all together and come up with that diagnosis.
And what you'll find is the more you do of it, the more comfortable you become. It becomes much clearer what you're looking for in terms of kind of telltale signs like the pattern of the headaches, the pattern of the symptom presentation, what might be more reflective of a concussion versus what you might be linking to some historical patterns with that patient. It's just like anything else that you assess. You get better the more you see of it.
We still don't have a good, what I call pregnancy test that says either you have a concussion or you don't have a concussion. It's really more art than science.
There still is not that one golden arrow that we can utilize to nail down that definitive diagnosis. It has to be a comprehensive overview and compilation of what we see during our clinical assessment.